Dr. Walls, what are the core principles of Wahls protocol, and how how it differs from traditional MS treatments?
So I'll start with traditional MS treatments. There are drugs that are approved that reduce the number of new enhancing lesions, reduce the number of new relapses, and they're actually very effective at that. These new drugs can extend the time that you would have gone from a diagnosis to wheelchair by about 5 years. And so that's profoundly good news for everyone. But you still end up with progressive disability, with cognitive issues, anxiety, depression, brain fog, cognitive decline. And you still end up with this progressive fixed disability that begins to accumulate around age 45 or 35 if you were diagnosed as a child. What's different about the Wahls protocol is I want you to think of this as an adjunct to whatever disease-modifying treatment that you've elected to do with your specialist. It addresses all the environmental factors that are contributing to the health and vitality of your cells. So it's talking about diet, it's talking about targeted supplements, about sleep, about reducing environmental toxic exposures, about rebalancing your hormones, about adding movement and exercise. And we have helped people address these various domains and the modifiable lifestyle factors at the pace that they can manage, and ideally doing these interventions as a family. I want to remind everyone that in my clinical practice, when I was still at the Veteran Affairs Hospital, I was so successful that we created a new clinic that I ran, the Therapeutic Lifestyle Clinic, and we taught people how to use these concepts. People who were living very humbly, living on food stamps, who had lost their jobs, were disabled, shopping in small rural grocery stores here in rural Iowa, or convenience stores because that's all they had in their little small town. We saw remarkable results, remarkable improvements in quality of life, less pain, more mental clarity. And over time, people could reduce their prescription medication use. So this is the most of the Wahls protocol concepts you can implement without spending more money. These are modifiable lifestyle factors that are mostly have to do with your choice. And improving the quality of your food at the pace that you and your family can manage is certainly part of that. But much of the modifiable lifestyle factors are parts of our daily choices that will not cost you more money for implementing.
Or in fact, it may cost less money than
It will cost less.
ultra-processed food, or more expensive probably.